Okay, we're doing finger MP extension, and the muscles tested are extensor digitorum, extensor indices, and extensor digiti minimi.
Okay, so the patient's gonna have their forearm on the table in pronation, the wrist in neutral, and the therapist is gonna stabilize the wrist. The patient is gonna be asked to extend at the MP joint, at their knuckles, and if they can do that on their own, then they have a 3. If they can do it against resistance of my index finger on the proximal phalanx, then that's a 5. A 4 would be partial resistance. If they can't do it on their own, then you put them in an anti-gravity position, and you'll ask them to extend their knuckles. They can do it on the side, that's a 2. And if they can't extend them, then you want to look for contraction of the extensor digitorum, the extensor indices, and the extensor digiti minimi. And if you can feel contraction of those muscles, then they have a 1. And if there's no contraction at all, then that's a 0. And a substitution would be flexion at the wrist, which would cause the IP joints to extend and the tenodesis effect.